angle, you have fast, good, and you can only pick two. So you got your Toyota Corolla, which is, you know, cheap and good. And then you've got your Mercedes, which is fast and good, but definitely not cheap, right? So, Rick, would you say pick three then?
Well, I hate the word cheap. I believe in context should be affordable, efficient, and clinical standards are set by our profession. Good's really nothing more than a perception in this context. It's about SOPs, great professionals, people that respect themselves and respect their patients. And then it comes down to repetition. We provide more dental care by procedure, maybe not by fee per hour, but our docs are efficient, they're gentle, they provide a quality, restoration to the patients. Our labs are efficient, all right? So therefore we have less repeat visits. So I do believe all three can exist. It's a matter of having people that are on point, that they're not putting the economics of what goes in their pocket before the ethics of what the responsibilities of the profession is.
Okay, so if you can find me a fast, cheap, and good car, let me know. I'm very interested. But you mentioned that you have 3 GPs, 4 specialists. If they're good at what they do, they can't have obviously lower salaries. And since they get paid a percentage, you need to make that up by working faster and seeing more patients. So how do you keep that profitable?
Well, first of all the doctors are compensated of what industry standards are. For us, it's a matter of capacity in the office. So if I have, for example, we have 9 rooms. If I have 9 rooms constantly filled with patients with an operator in each room, and we're not breaking that patient experience by pulling people away to jump into a different place, we're able to produce X amount per hour, per chair, and the doctors are making a reasonable return for their efforts. They all work extremely hard and diligently. They're all top-level professionals, and you can't get people that have egos. All right, when you have a massive ego, it's very difficult to work in this kind of environment. It's all about working as a group. The collective works out really well. So when we're sharing a space, sharing the technology, sharing the staff, therefore we can actually have that distant experience from the phone call right through to when the patient is leaving. It is a certain efficiency to that. When you're in a solo environment, the same things we're doing, you're doing that solo environment for one practitioner. When I have, let's say, 3 clinicians and 3 or 4 hygienists working simultaneously, it works out to be, all right, economically feasible to have a slightly modified fee or a lower fee than being in a boutique practice and still end up as a business owner, all right? Having profitability. So your profitability as a solo practitioner, if you're in the ideal standard, you want to have about a 60% gross margin on everything. In these kind of practices, 18 to 20% is wholly acceptable. When you look at the gross number, all right, it's a very substantial number. And it's also a reproducible income, because it's not based upon me doing work, it's based upon my brand doing reproducible work time and time again. So everyone is there working on that same team, trying to provide that same level of care and the same experience. Again, because of shared expenses. So that works well, so everybody can be compensated. And I'll get into other things with regard to cost savings and things like that in a larger operation. More people, more providers, bigger facility equals bigger discounts from all of the things that generally you're buying at rack rate. So that's the secret sauce of having a larger operation being financially workable. It's all about having realistic expectations. If I was to say I want to add 10% more to my bottom line, it's not going to happen without it seriously affecting something in the system. You got to be realistic to what you have and who you are and what's your role. What are you providing back, all right, to society, and what's your expectation for your work output?
Perfect. Carolina, same question for you. You have fast, cheap, and good. Would you say pick 3 as well?
No, expensive and good. I don't believe in our profession it is fair to try to be fast. You can be rapid working on a patient, and some people might be able to work fast and well, and their productivity allowed them to be good. Rick is undoubtedly one of those. I've known him for years, but we don't all have the same hands. Uh, I was rapid working on patients. I was efficient. The moment I said, open your mouth, after 30 minutes talking to the patient, you see how much I love talking. So after 30 minutes talking to a patient, I would say, open your mouth. I would put a bite block and would not remove that bite block until I was done. So the patient could not close his or her mouth anymore. I mean, until I got done, and I was rapid working. Now, fast in our profession would mean that we are linked to other professionals. We are linked to lab technicians, and I don't believe in accelerating the turnaround of a lab. I know their job. I had my own lab for years. I know how difficult it is. I know how demanding it is. I don't believe in having a rapid turnaround, even at a time of digital milling. You know, if the scanning is done, if they scan the impressions and the scanning is done too fast, it is proven. And Christensen published something yesterday on dental economics saying how the margins of a zirconia crown are so much worse than the margin of a PFM, of porcelain fused to metal. So I would not try to have a fast turnaround. I don't think dentistry can be cheap. I don't think dentistry can be cheap. Of course, you have composites. You have, you know, the both ends of the spectrum in brands. Of course, you have cheap, and I'll use the word cheap, implants and expensive implants. But do you know what those companies are giving you behind? I worked in Tanzania for 5 years, where patients were flying from other countries and being expats in Tanzania, and they had brands of implants. I mean, I would have sworn they were screws from a hardware store. They did not look like implants when I took x-rays. I did not know what they had in their mouths, nor did they, so I could not restore them. So I don't believe in dentistry. Dentistry has minimum standards. Of course, Rick said that clinical standards are set by the profession. I have to disagree with that. The profession sets standards, clinical standards, but clinical standards can be high, can be low. Your standards are set by yourself. And I'm not saying it's fair that we pay composite more expensive than gold, because when you look at the weight of a syringe of composite, it's more expensive than gold. It's like, it's insane. I'm not saying that chain is fair. We are being the first ones that get hit by the fact that supplies are highly expensive. But if you want to use good quality supplies, there is no way, in my opinion, dentistry can be cheap. I had to be what I consider cheaper in my country than what I wanted to be, because my country did not allow for the fees that I thought would have been fair for the work I was doing. So I had to also work the volume. I had to work extra hours. I was never a 25-hour-a-week dentist. And my daughter knows it. I raised the kid alone. I was never a 25-hour-a-week dentist. This is why I decided to leave my profession when I read a book by Tim Ferriss called The 4-Hour Workweek. When I read The 4-Hour Workweek, I said, WTF, what am I doing working between 40 and 50 hours a week? So, I mean, if I had been in the US, it would have been a different story, but the country where I was living did not allow me to charge the fee that I had to charge for the work I was doing, but I chose to work more. I never chose to do different work or buy different materials or change brands in composite, in implants, even needles. To me, needles were the most important thing, because that's the first thing that can hurt a patient. I would spend a fortune in the best bevel needle there was in the market. So no, I cannot believe that those three can coexist. If you're giving a high value for a low fee, that will work. My office got submerged with patients because I was giving at the beginning a very high value for a low fee. And I was at that point being trained by Carl Misch. And I said to Dr. Misch, I can't make ends meet. I'm working 50 hours a week. I'm doing amazing work. And I have 3 weeks of wait list. You know what Dr. Misch said to me? He said to me, Carolina, the wait list is only feeding your ego. The wait list is not feeding your child. So get rid of that wait list. Raise your prices. If you have the guts, when you go back on Monday, this was in Pittsburgh, when you go back on Monday, multiply your prices by 2 and let's see what happens. God bless him. I did it. Of course, the wait list went away. Of course, that filtered my patients. And of course, I started making ends meet. So my mentor helped me build the model that I built.